Now to the coronavirus pandemic. The U.S. has reached a new milestone in its race to vaccinate. Half of all U.S. adults are now fully vaccinated against the virus. Nearly 50% of the entire population has received at least one dose. And the U.S. could soon have a second vaccine for adolescents. Moderna plans to seek emergency use authorization for this age group next month. As Mola Lenghi reports, it comes just in time for the new school year.
Tonight, Moderna says its vaccine is 100% effective in children ages 12 to 17 with no significant safety concerns.
We have not only a single company, Pfizer, but it looks very much like we'll have the source of another similar vaccine, an mRNA for Moderna.
Moderna will request FDA authorization in early June. Having both the Pfizer and Moderna vaccines available for kids could boost the chances of fully reopening classrooms for in-person learning this fall. But a lot will depend on whether young people will get the shot.
I'd like to think now that we have vaccines that are available for all those over 12, that parents will do everything they can to make sure their children are vaccinated.
So far, just under 20% of 12 to 17-year-olds and just under 40% of 18 to 24-year-olds have received at least one dose.
It's slower than you want. Children can still suffer this disease, and I think parents tend to see children as relatively invulnerable here, and that's not true.
Today, Dr. Anthony Fauci told a House committee any vaccine for children under 12 will not be available in time for the new school year.
The age de-escalation studies that we're doing to get to an 8-year-old would likely not be available towards the end of this calendar year.
Meanwhile, the head of the CDC reminded Americans they are not protected unless they're vaccinated.
If you are not vaccinated, our guidance has not changed for you. You remain at risk of infection. You still need to mask and take other precautions.
The CDC has stopped investigating breakthrough cases, those rare instances when a vaccinated person becomes infected, unless that person is hospitalized or dies. Now, critics say the agency is missing an important opportunity for more COVID research, but the agency insists this allows them to focus on the most serious cases, Elaine.
Mola Lenghi, thank you. Dr. Sejal Hathi joins me now. She's a physician and clinical fellow at Massachusetts General Hospital. She is also the host of the Civic RX podcast. Dr. Hathi, welcome. Half of all U.S. adults in the U.S. are now fully vaccinated against the coronavirus. How significant is that?
Well, Elaine, firstly, thank you for having me. And it is a tremendous milestone that we have reached today and this week with 50% of adults now fully vaccinated against the virus. Only about 20 million more adults across the country need to be vaccinated between now and July 1st to meet President Biden's goal of 70% at least partially vaccinated by that time this summer. And we're going to get there, even with the slower pace of vaccinations, the 2 million per day. I think that it's clear that we are doing an excellent job, much better than many had anticipated in vaccinating people across the country. And the recent news with Pfizer and Moderna are only additionally promising junctures in that journey.
Well, Moderna now says its vaccine strongly protects children ages 12 to 17. Pfizer's vaccine has already been approved for this age group. Why is it so important to have more than one vaccine available?
Well, part of it, Elaine, is vaccine supply. Of course, we are producing more than 10 million more vaccine doses than we need per week. But even so, it's important that we have enough supply. We're also studying how vaccines respond to the variants that are circulating across the country and variants that may emerge across the globe over the next several months. So having multiple sources of vaccine available to potentially counteract new variants is incredibly important. And of course, Pfizer and Moderna have both reported excellent rates of efficacy against COVID-19 in children, with Moderna reporting a 100% efficacy in its most recent results today. And so with either vaccine, we know that they're safe, they're effective, and I'm excited about what that means for a semblance of normalcy this summer.
Yeah. Well, according to the American Academy of Pediatrics, the U.S. recorded fewer than 40,000 new child COVID cases last week. That is the lowest number seen since early October. Doctor, what is behind that drop?
So thanks for asking that question. Again, it's wonderful news that cases across the country, across all age groups, are falling. We are at the lowest rate of 25,000 cases per day that we've seen in the last 11 months since June of 2020. And of course, kids are in that category. I do want to caution, however, that even though cases are falling across all age groups, pediatric infections among kids are forming an increasing percentage of the total number of new weekly cases that we're seeing in this pandemic. Pediatric infections represented about 14% of the total COVID-19 cases since the pandemic began. We're now up to 20 to 25% of new weekly cases. And that's because as adults are increasingly vaccinated, children constitute a higher proportion of the unvaccinated and therefore those more vulnerable to infection. So even though we're seeing lower case rates day by day, week by week, it's important that we remain vigilant and that children, particularly unvaccinated children, continue to practice physical distancing and to mask, especially in indoor areas.
Finally, Doctor, a CDC report found breakthrough infections among vaccinated people make up only a, quote, small fraction of cases in the U.S. But why do these breakthrough infections happen, and why is it important to track them?
So that's a great question. And breakthrough infections happen all the time. Let's first define what this means. A breakthrough infection transpires when someone who tests positive for coronavirus did so more than 14 days after their second dose of, in this case, the Pfizer or the Moderna vaccine. So that's a breakthrough infection. Now, we know that, of course, only about 0.01% of vaccinated people have breakthrough infections. But a large majority of these cases come from new variants that are circulating across the country. And so it's important to figure out, to track these breakthrough infections to determine which variants are more responsible, perhaps, for new cases, which age groups, which demographics are more vulnerable despite vaccination to breakthrough infections, to reinfection, and to really determine how we can ensure, as more and more of the U.S. population is vaccinated, that we can keep that rate of breakthrough infection down. Breakthrough infections happen with any vaccination campaign, with any virus, and it's inevitable that we're going to see a number such as that we've seen with this pandemic because so many people are getting vaccinated. Inevitably, there's going to be a percentage of folks who, unfortunately, because of exposures to variants or because they were unable to mount a sufficient antibody response, perhaps they were immunosuppressed. Inevitably, we're going to see some small rate of breakthrough infections, but at least we know that it's a very, very low rate. And now we just need to determine by studying those who have been reinfected why they were, so we can ensure that the minimum number of breakthrough infections occur in the future.
All right, Dr. Sejal Hathi, thank you very much.
Thank you.